Thank you everyone for joining us for this webinar today. My name is Jessica Omukuti and I am a postdoctoral research associate here at the IJDC. So this webinar is hosted by the IJDC, which is the Interdisciplinary Global Development Center at the University of York. IJDC is an interdisciplinary learning and research community for equitable global development. And we undertake research that is quite interdisciplinary with a particular focus on social justice, global health, and sustainable environments. We also offer a range, we also offer undergraduate and postgraduate academic programs in global development. And the center brings together a very a diverse number of researchers from the humanities, social, and natural sciences within the university and globally. And we encourage our researchers to work with one another and with policymakers and practitioners to address the global development challenges that we are aware of. And I think that is why we're here today. And today's webinar is the fourth in IJDC's COVID-19 webinar series. And I'm really excited about this. And the series will explore the economic and financial consequences of COVID-19 on women. It will feature a very, very interesting set of speakers who will present case studies from their own regions, but also from across the world. And we'll reflect on the impacts from COVID, but also how different groups, countries, and institutions are responding to COVID. We'll also not just in this session, but also across the webinar series, we have been asking our discussions to focus on how global development researchers can contribute to a better understanding of the impact of COVID-19 and reducing the impacts of the likelihood, but also the impacts of future pandemics. Before we start the webinar, I'd like to mention just a few housekeeping points. First one is that this session is being recorded. You can see the red button somewhere there, but only the video and audio of the panelists are being recorded. Attendees' mics are muted and your video is off, and so you will not be recorded. The information that may be recorded are any questions that you type in the Q&A, which is also somewhere at the bottom of your screen. And when you please type in your questions, please, you may include your name, which could be used to identify you based on your, so if you ask a question and if you include your name, we might use your name to identify you. Questions and answers, if you have any questions, like I mentioned, and you'd like to address them to any panelists, please click on the Q&A button at the bottom. And then we will select the questions from those submitted and try to answer as many as we can. You can submit questions at any time during while the speakers are speaking, but also after, just before the end of the session. And we will have a Q&A session at the end. If you notice any questions in the Q&A and you are particularly fond of them and you like them, please, we ask you to upvote them. And then they'll just move to the top and we will get to address them. For those who like tweeting or who prefer Twitter, please, you can find us today on the hashtag IJDC webinar. And then you can also tag us at there's our at York_IJDC, and we will engage with you on that. Technical support. So if you're having any technical issues, please use the chat function to talk to us, hashtag IJDC webinar, and our hosts, including me, will be able to respond to that. So just to reiterate, please put your questions in the Q&A section at the very, very bottom. And if you have any technical issues, please post them in the chat and yeah, we'll have a look at them. Now, I'm really interested. I'd like to introduce our chair of today's webinar. We have Dr. Ingrid van Graven, who is a lecturer in international development at the Department of Politics. Her research focuses on global trade and finance, the history of economic thought, and the political economy of development. And her work can be divided into three main categories: One is the role of finance in development. Two is structural features of underdevelopment. And three, an assessment of policy recommendations by international organizations. She has a PhD in economics from the New School, and she and her BA and MSc degrees in development studies from the University of Oslo and the London School of Economics and Political Science, respectively. Now, please, Ingrid, please.
Thank you, Jessica. Hi, everyone. So I will present the speakers and the topics quickly. So COVID-19, as Jessica already mentioned a little bit, so it's exposed these structural weaknesses and inequalities in our societies. And in particular, in this webinar, we wanted to discuss two forms of inequalities that often aren't discussed together. So one is the important financial problems that developing countries are facing due to the costs of dealing with COVID-19 and lockdown, but also because of the massive capital flight and export losses, along with completely inadequate financial packages that are being offered by international financial institutions like the IMF. And there's been a dramatic reversal of capital flows in the wake of the pandemic, and many developing countries have experienced currency depreciations as well as severe debt and liquidity problems. So we have that on the one hand. And then on the other hand, we have feminist economists across the world pointing to the fact that COVID-19 also exacerbates gender inequalities because of the uneven impact of lockdown on women. And so this webinar brings these two perspectives together to unpack the economic and financial consequences of the pandemic on developing economies generally, and on women in developing economies in particular. So this will also open a discussion on what kinds of policies at the global and domestic level are necessary to address the challenges developing countries and particularly women face. So we have two excellent speakers to guide us through these issues. One is an expert on international and development finance. The other is an expert on macroeconomics and gender in development. So they are Daniela Gabor is a professor of economics and macro finance at the University of West England in Bristol. And she has published extensively on central banking in crisis, on the governance of global banks and the IMF, and finance and development more generally. And we have Christelle Simeoni, who is a director of NAWI, AfriFem Macroeconomics, where she works on women's rights and macroeconomic policy at the regional and global level. She has previously served as the head of advocacy and lead on economic justice at Femnet, which is one of Africa's largest women's rights networks, and a policy lead for the thematic area on international financial architecture at Tax Justice Network Africa. So this is a great lineup. But before we start, I just want to run two quick polls so that we can get to know you, the audience, a little bit better, and just so that we know who's here. So we do this at every webinar. So just take a few seconds to answer where you're based. You'll see the poll on your screen right now. So that you should see both of the questions. Yeah. I think we can end it now. Perfect, thank you. Okay, great. So now you can see where the other audience members are based. Seems to be a little bit of everywhere. A lot of audience members from Europe and in academic institutions, but there is some diversity there. Great. Thank you for that. So I think now we'll pass over the floor to Daniela and Christelle, who have coordinated, so they'll be presenting together.
Thanks. May we have the first slide up, please? And while that's coming up, good afternoon from Nairobi, everyone. It's really great to see the different countries. It gives me some sort of an idea of who I'm talking to, sort of. Yeah, so like Ingrid said, Danielle and I had some conversations about how to not make this another boring webinar. We'll see how that works out. So bear with us. We're gonna give it a go at having a conversation rather than just presentations in the way that we've all been zoomed out. So we're going to go over 3 things. And the first area is centering development around finance. And I'll pass that on to Daniela in a bit. And then that will obviously take us into the history of what's happening with finance being at the center of development and how colonial frameworks worked and continue to work. And then hopefully begin to paint a picture of a little bit of a brighter future as we go along with this crisis, but everything else, Black Lives Matter and everything else that's happening, and what does a future that seems a little bit bright look like, and what do we need to do to get there. So I'll pass on now to Daniela to take us through a little bit of her area of work that is super exciting. The first time I heard her speak, I really had no idea what she was talking about, and she pulled up all these diagrams of icebergs, and I just couldn't figure out what the two had to do with each other. But her work is really important, and the more I've gotten to know her and read her work, sitting on the continent and living and working out of Africa, it all seems so relevant and explains a lot of things that I see around this iceberg that she keeps referring to. So I'll pass on to Daniela, and I'll come back in a little bit.
Thank you, Crystal. Well, not to set us up for disappointment, but I have no icebergs now. Although it was at my request that we have PowerPoint. Crystal told me that this is how academics kind of act. This is our protective shield. So thank you for allowing me to do that, Crystal, use my protective shield. Before I go into why the conversation between Crystal and I makes sense, not only because we're friends, but also makes sense on a more conceptual and policy level, let me just say hi from Transylvania. I'm in Romania, I'm Romanian, and I came home to hang out with my parents a bit in pandemic times. And you see it's a bit dark here. It's not because we're protecting ourselves from some Bram Stoker, Dracula kind of events. It's just my mom has a lot of plants in front of her house. So yeah. Going back to how do we think about the links between inequality in global finance and gender? I think it's important to try to sort of situate ourselves where we are in international development discourses, where we were before the COVID pandemic hit, and whether the sort of tendencies and what I think is a paradigm change in the way the development discourses are promising to take care of the sustainable development goals, whether this paradigm shift is likely to continue with COVID, or it's likely to be stopped in its tracks and a new paradigm might be emerging. You will not be surprised that I think we will continue with the status quo that we have, and the status quo I think has important implications not only in terms of the way we think about global inequalities that are produced and reinforced by financial globalization. That's a very important starting point, that for the last 30 years we have lived in an age of financial globalization. There are many ways to think about that, but I think the simpler way and the most relevant way is to think that global finance is increasingly powerful. It's increasingly powerful in terms of the resources that it has at its disposal, and in terms of its political capacity to influence and shape discourses, not only at the national level, but at the global level. Particularly, I would say that over the last 10 years, since the global financial crisis, we are seeing how global finance has become increasingly powerful in trying to create a new alliance with the international institutions for development. And here I'm thinking not only of the World Bank, the IMF, the multilateral development banks, but also national governments in the global north and the global south. And let me talk to you a little bit about this development paradigm that has appeared in the after the global financial crisis. And in a sense, it is an institutional child, I would say, of financial globalization and the power of financial capital. And this paradigm goes along these lines. It says, yes, everybody shares and understands the urgency of achieving the sustainable goals as fast as possible. We, particularly in the global south, we do not have enough public resources to put into accelerating this move towards the sustainable development goals, but we could have an important ally, and this important ally could help us deliver on these ambitions. And this important ally is private finance. And the World Bank, for example, has a new program that is introduced since around 2017 called Maximizing Finance for Development. The same logic you'll find in many G20 meetings, in many other multilateral development banks. And the logic is, or the discourse is, we have to center development around finance in the sense that we have to create the conditions to leverage private finance for development, to attract the resources of institutional investors and other types of financial institutions. And I'll tell you a bit why institutional investors are important in this story, because it's a story that hides and masks the very significant inequalities that we have in the global economy and in the global north in particular. So the idea is we have to attract these trillions of global institutional investors into development projects. But in order to do that, we have to create the conditions for them to be able to come to the global south and to the sustainable development goals. And the idea is let's then create asset classes that these institutional investors could be interested in. And these asset classes will be financial instruments of some sorts, including bonds or project loans. And these asset classes in the first place, if we think of how to create them, should center around infrastructure. So the G20 has a program since 2017-18 called Infrastructure as an Asset Class that is specifically and explicitly linked with the sustainable development goals. And what it says, this idea of infrastructure as an asset class, is to attract the trillions of institutional investors. We need to make sure that we transform and we package infrastructure that we're building into asset classes that are attracting for them. And to do that, in order to create this infrastructure as an asset class, the main emphasis is on creating public-private partnerships. So that's the sort of instrument to deliver infrastructure as an asset class. And when I talk about infrastructure, and when they talk about infrastructure here, they don't only mean roads, although it's particular, some of the focus is on roads. They also mean energy plants, renewable energy, and they also mean social infrastructure. And that matters a lot when we think in terms of gendering, and I'll let Crystal tell you more about that, in terms of gendering the idea of this project as of PPPs of infrastructure as an asset class, because the idea of PPPs is that the private sector is better placed than the public sector to build infrastructure. It's better placed because it has more resources available. It's better placed because it has it is more efficient. It's better placed because it is, in a sense, sort of isolated from the typical stories of corruption that we hear as being very important. And also the private sector has resources that the state doesn't have. So the idea is that the state will work hand in hand with the private sector in these public-private partnerships, and together they will build hospitals, together they will build schools, together they will build roads, together they will build renewable energy plants. And of course, the state has a role to play there, because the private sector, we know in many global south countries, is not coming. It has not manifested itself yet in this infrastructure as an asset class project. So the idea is, let's make sure that the state helps create the incentives for the private sector to come. And these incentives typically refer to the state taking on some of the risks that PPP projects have. And what are the risks for the private sector in these PPP projects typically have to do with demand risk. And that's very important when we think about gender inequalities, because PPPs and infrastructure as an asset class are projects where you are replacing public goods with user-based fees. To go to the hospital, you have to pay. To use the highway or the road, you have to pay a toll. To have a PPP in an energy plant, the state will have to buy from this private energy plant and to guarantee that it buys the energy that it produces. So there is a very important role for the state and a very important mobilization of public resources to de-risk these private infrastructure projects. And that's the idea is that's very important, because once you do that, then you also have the asset class becoming more attractive, because institutional investors will be assured that if they buy the bonds that are financing these projects, there will be payments coming into these bonds, right? So very important, the role of the state here is to de-risk projects. And why does the state prefer to go down the PPP route in building a hospital instead of going the traditional public investment route? Well, there is a very interesting accounting trick here, and this reminds us of the importance of also situating ourselves politically within the paradigm of neoliberalism that we had with the Washington Consensus since the 1980s, which is the idea that the state's fiscal resources are limited and should be deployed as efficiently as possible, and shouldn't be deployed very often, if at all, right? So there is this idea of fiscal discipline, and the PPP discourse fits very well with this idea of fiscal discipline, because the state says, yes, I will guarantee against some of the risks that building infrastructure through PPPs generates, but these guarantees do not appear on the balance sheet of the state immediately. They are what are called off-balance sheet or contingent liabilities. They only materialize if those risks materialize, the pressure on public resources. So it's a very nice political project for many governments in the global south, because they can say, oh, I'm going to build a huge new road that will bring the market to these communities that have previously been sort of kept away from them. I will build new energy plants that will bring light to many communities that cannot develop and cannot grow because they lack these very sort of basic resources, and I don't have to pay for it. Not now. It will not appear in my debt to GDP ratios. It may appear at a later point in the future, but that is contingent on things going wrong. And the assumption here is that things will not go wrong, things will go right. Poor people everywhere in the global south will be able to pay for their hospital fees, they will be able to pay their education fees, they will be able to pay their tolls. Okay, so that's very important. And if you go to the next slide, I just want to show you how important this discourse is already in terms of shaping the relationship between the state and the global discourses of maximizing finance for development, and this push for PPPs, PPP-based infrastructure as an asset class. Here you have in PPPs in the energy sector, where new energy plants are built by the private sector, but within a public-private partnership framework. And you can see here that public entities, one way or another, are guaranteeing the demand for these private companies. In other words, it doesn't matter whether for example, your network infrastructure for energy can absorb all the infrastructure all the energy that's being produced by these private plants. And there is a very interesting example from Nigeria, the Azura power plant, where the state had to buy more energy that it could actually distribute through its state-owned network. And he had to buy it because he had signed a PPP contract with the World Bank, also providing a guarantee, and he had to buy it because it had promised to do so. And we can see here some really interesting statistics of how much of the public sector entities and payment guarantees are actually guaranteeing the sort of profits and rentability or profitability of the private sector. And it's quite interesting to me to see here that Sub-Saharan Africa has combined the largest share of guarantees across all regions that are mentioned here. 58%, it's quite high. It means basically the state is guaranteeing around half of the activity that is done by the private sector in electricity, in the electricity sector. You will see that East Asia Pacific also has quite a high percentage, also because the World Bank has been pushing PPPs there. And incidentally, Crystal and I were looking at it some time ago. The World Bank has a project for creating a PPP legal infrastructure in every country. It pushes countries and it finances the creation of PPP offices. So it makes sure that these contracts, which are they are very complicated contracts that require a lot of legal expertise. Poor countries in general might not have this legal expertise, so the World Bank says, oh, don't worry, we'll help you build this up by buying you some nice furniture and an office space. And you can see that this is the case in East Asia and Pacific, to some extent less so in Latin America and the Caribbean, although there is a great push for PPPs there as well. Peru is a very good example. And why is this important? It's important because it tells us something already about what is at stake when we are bringing global finance and international development together. It tells us what is at stake in terms of the ability of the state to fulfill its social contract with the people. And the social contract is increasingly being mediated and transformed because it puts private finance at the core of this process. And if you go to the next slide, please, I want to show you a very interesting example of a contract that has been signed by the government of Cameroon with a private constructor of the Nachtigal hydropower plant, which is supposed to be the largest power plant, at least hydropower plant in Africa. And you see here what is the distribution of project risk allocation between the private constructor and the operator and the government of Cameroon, which is there in the second column, government of Cameroon. And you'll see that the government of Cameroon has the most X's in the entire column distributed across the various parties to the contract, right? From multilateral development banks to the producer of energy. And the government of Cameroon is expected to guarantee, to be involved in providing guarantees or de-risking the activities of this private operator in terms of tariff payments. So if poor people in Cameroon can't pay for this electricity or the companies can't pay, then it will be the government of Cameroon who will supplement this in order to make sure that there is no demand risk. You will see that the government of Cameroon is also guaranteeing against currency devaluation. This is something quite extraordinary in the sense that it tells foreign operators you do not have to worry about exchange rate volatility. And we know during pandemic times and in countries that are exposed and vulnerable to the global financial conditions, either because they have issued a lot of external debt or because they've had capital inflows and then outflows, we know that exchange rate volatility is quite significant. The government of Cameroon is saying here, you don't need to worry, I will pay for this if there is significant exchange rate depreciation. And the last thing that I want to mention here is, again, that public resources will also be directed or will also be on the spot if a new government in Cameroon comes up and says, I want to increase minimum wages, or I want to change any regulations, including environmental regulations, that might affect the profitability of this company, then it will be the people of Cameroon through their taxes that will eventually be compensating these private investors for the decisions of a new government to change the sort of the macroeconomic conditions and the labor market conditions. So I will finish here and let Crystal tell you a little bit more about why also there are some very important hidden gender aspects of the push for PPP infrastructure as an asset class project.
So I'll ask for the next slide. Sorry, I didn't unmute myself. Yeah, so just taking on from Daniela, and we've been talking about this a long time, but also the work that she does and the research that she does hiding behind PowerPoint slides really informs the reality that I live every day and informs the work that I do in terms of the policy pushes that we do and the analysis that we do. And there's such a linkage between her analysis and research and the policy and advocacy work that we do on the continent. So what you see up now is comparing debt servicing and health spending in Africa. And it's important to look at this, especially now as we go through what is being touted as a health pandemic, but really it's a political struggle, I think, and it's one of power at the heart of it. And if you look at all countries, especially Ghana, the percentage of government revenue spending on servicing external debt is way higher than the percentage of government revenue spent on health. And this is from a Christian Aid report that's just been released this week. And you can go, I'll send out the link, but you can find it online with links on Twitter. But it really paints a picture of who we're putting at the heart of development of our own people. It tells you where our government has to put priorities in terms of spending and where it's not. And so this also begins to explain the concept of when Daniela spoke about private finance and private creditors, and this information is just beginning to get some analysis. So it's really hard to get something like this in terms of, and this is a research area that is open and I think needs a little bit more work on in terms of the percentage of external debt to private creditors versus the usual IFIs. And for our countries on the continent, for sure, we can see that increasing quite dramatically. I'll ask for the next slide and I can show you how. So this is from the health budget from Kenya, from the fiscal year 2016-2017. And if you look, I've underlined in red the lease of medical equipment. And this was a project that was started about 5 or 6 years ago. And what the government of Kenya did, as Daniela said, we don't have the capacity to provide specialized health machines to all our hospitals. So we will look to private finance to do that for us. Now, it was a very strange contract that was drawn up because the health sector in Kenya is devolved. The only thing that's left at national level is policy making. The rest of it, in terms of implementation, is down to a county level because we have a devolved state of governance. So what the contract says, and it's also very hard to find access to the contract, which is also an issue that we need to remember, is this lack of transparency, because these contracts are negotiated in private as they're business contracts, but they're affecting and having a huge impact on the quality of life of people. And so we don't have a seat at the table. Women definitely don't have a seat at the table in determining what their maternal services looks like and who's spending on what. Instead, the World Bank and the IMF will be sitting at these tables of negotiations and making decisions for these, that have a huge impact on the lives of people. And so what they did in this contract was they decided to lease out specialized equipment like theater machines and ICU machines from 5 companies. There was General Electric, there was Philips, there's an Italian company, a Chinese company, and an Indian company. And they were going to lease two hospitals per county. We have 47 counties in Kenya, this medical equipment. Now, the problem is they signed, the money was deducted centrally at the central government. And so that money was taken out of budgets that would go to health budgets at a county level. And they were going to hospitals where there was a combination of, or completely all the 3 things, a lack of water flowing, tapped water, so they couldn't run the machines. There wasn't 3-phase electricity, so they couldn't run the machines. And most importantly, they didn't have the requisite specialized technicians or doctors. Some of these hospitals don't even have doctors. They might have a clinical officer. And so they've been lying there for 5 years plus. We're now going into the 6th, 7th year. Nobody using them, but yet we're having to service these loans and these contracts. And from this graph on here, you can see that it was in 2016, 2017, our 3rd highest health budget spend for the whole entire country. Now, this is before free primary health care, it's before universal health care, it's before community health care that we desperately need in these times of COVID. And COVID has really opened up to see where our failures and our weaknesses and where the real underbelly of this neoliberal agenda that we all have bought into is coming up. And so with that, and we continue to pay it, there's questions over who sets a priority in terms of whose development are we talking about. And when we talk about private finance and a social contract, and from this, you can really see the social contract moving from one between state and citizen and moving towards one between state and private finance. Citizens are nowhere in that equation. The Kenyan constitution is very heavily embedded in public participation. There was absolutely no public participation in the signing of these contracts. There's absolutely no access to these contracts, so you have no idea what's happening. At some point, the budget for them almost doubled, and there was no conversation around, why is it doubling? What is this money for? And what's happening there? And so I really think in terms of gender, with putting private finance at the heart of decision making, it means whatever is the most profitable gets done. Currently, what we see on the continent, the most profitable things are mega infrastructure, and not profitable, not for us, mega infrastructure projects. So there's rails and highways, tolled highways, and these big projects that a large majority of our population, 70% of the Kenyan population, definitely is informal, and so can't access this, and can't access because of user fees that Daniela said. And now we go back to a colonial construct. In Kenya, user fees were introduced with the colonial government, and they were shortly dismantled post-independence, and then brought back through the structural adjustment programs in the 80s and 90s. And so it's a reincarnation of the very same colonial frameworks that we see. Further to that, we can also see the very extractive nature of what colonialism did for the people of the continent, for Kenyans and the wider continent of Africa. In terms of extracting, I think there's been some analysis done on what the slave trade meant in terms of a free injection of capital through slave labor and time to Western economies. And that was really the the basis of the Industrial Revolution, slaves who grew sugar for calories and cotton for trade, and what that means, I think, calculated at a minimum wage of today's American minimum wage, I think it was over $60 trillion as an injection into their economies. And so that, in terms of being a very extractive nature, then morphed into the structural adjustment programs of the 80s and 90s. And Africa did seem to be on an upward trajectory post-independence. There's definitely some mistakes that were made, but generally there was a people-centered approach to policymaking and economic policymaking. And so, we've now moved into what, Daniela calls a Wall Street consensus, and it's the same exact thing. It just wears different clothes, really, but at the heart of it, it's the same extractive nature. It's one where our people are not at the center of development discourse or decision making. Jason Hickel calls this a global apartheid of decision making in terms of economic decision making. Who sits at the table to decide what happens in the global governance of our economies, and who's pulling the strings? When we are taking loans, and who's giving conditions, and what conditions are we taking? So the loans that we're taking, what conditions are they set with, and who are they supposed to develop, whose lives are they supposed to benefit? And I think those are interesting questions, but I'll let Daniela finish with her last table, which was really interesting, on what economic cost of lockdowns look like.
Okay, so thank you, Crystal. We have 5 minutes left, so I'll speak faster now. I think the question that we also need to think of now is, if these were the kind of developments and sort of paradigm shifts that we saw before COVID, is it likely that they will accelerate, that the COVID pandemic will accelerate them, or will it stop them? And I think at first sight, one can almost feel tempted to be hopeful, because the COVID pandemic has somehow brought back the importance of the state as the first and really the only possible actor that can provide particularly health services for its population. And the temptation is to think that we will move away from this idea that we can only build hospitals, or we can only build social infrastructure as an asset class in order to attract the trillions of institutional investors, and move much more into a direction of reclaiming the state as the basis for a collective provisioning for uncertainties, including the uncertainties of global pandemics. However, the temptation to be optimistic is very short-lived, I'm afraid. I think if we look at this economic cost of the lockdown for Africa, but the same story you can tell about any other region in the global south, they have had a sort of triple whammy hitting them of reduced revenues from exports, of capital outflows, and increasing public debt to GDP ratios, because obviously in the first place, governments had to put in and increase the size of spending on various sort of emergency measures associated with the pandemic, including, for example, the provision of some wage guarantee or some revenue guarantee of some sorts. So obviously, in a political environment where your public debt to GDP ratios are increasing, the logic of the Wall Street consensus that says you don't need to worry, even if you don't have a lot of fiscal resources, because private finance will build stuff for you, that becomes even more powerful and even more persuasive for governments in the global south. And you can see already that in the discourses of the World Bank. There is a whole World Bank has a whole website dedicated to PPPs and to the maximizing finance for development in infrastructure agenda. And you can see there already some of the discursive tendencies or discursive pushes of the Wall Street consensus sharpening what the World Bank is saying now. Yes, there are more risks that are materializing during the pandemic. So what this tells us is that the state has to take more on its balance sheet, either indirectly through the PPPs. It has to take more of these risks in order to make sure that these infrastructure projects are being built, and the trillions of institutional investors come here. And incidentally, the trillions of institutional investors have grown massively during the global pandemic, and that's something else that tells us how pervasive the power of global finance is in shaping responses to the crisis, both in the global north and the global south. And when you ask yourself, who are these institutional investors? We typically think of these institutional investors as pension funds, like my pension fund, because I contribute to a pension fund in the UK. There are private pension funds that have to hold assets, including assets produced through this infrastructure as an asset class project. But a very interesting and very striking statistic for me is that out of the 110 trillions of assets that are in the institutional investor world, around 93 trillion are coming from high net worth individuals, typically situated in the global north, which is a very direct and sharp expression of the global inequalities that are associated and produced by financial globalization. It's just a lot of rich people, not a lot, a handful of rich people have a lot of money, and they're using the institutions of international development in order to try to create conditions for extracting profits from the global south. And these, of course, these mechanisms of extraction, as Crystal says, they have their roots in colonial practices, but now they are coming with a much nicer and discourse where the sustainable development goals are put at the front of every initiative, and therefore it generates a sort of legitimacy that I think we need to dig much deeper into, and to expose the ways in which behind the promise of the sustainable development goals achieved through maximizing finance for development really lies a lot more of the same status quo inequality, a lot less access to very good public services, including in health. And I'll let Crystal give you the positive take now in the 1 minute left.
Yeah, so I think one of the greatest things, and working in the intersection of Pan-African feminist narratives and analysis and macroeconomic policy, is a lot of things that are coming up now, being talked about, and narratives that are being pushed and talked about are things that we've been fighting for so many years. I opened up a book from Dawn, The Development Alternatives for Women for a New Era, from 1985, and their narrative was exactly the same as what we're talking about now. In fact, people like Geeta Sen must be so completely bored with all of this, because it's been repeating for over 35 years. But I think questions around essential workers and who is really holding up our economies and our societies is suddenly not tax planners or bankers or stock exchange market people. It's nurses and mothers and supermarket workers and frontline people on the front line, on the very front line. It's, you know, parents taking care of children at home and trying to have, you know, webinars at the same time. It's all the people delivering food to older people of populations. Suddenly the sense of community is coming up, where we don't, you know, we can't always rely on the state, but we are this community that we are supposed to be as a nation. And so what does that mean as we go forward? And I think we're at a crossroads where we can decide which way we're going, who essential workers are, and who and what do we want to put at the center of our development practices and policy making, and how do we want to do this? Debt isn't necessarily a bad thing, but what are we borrowing for, and how are we borrowing? And the devil is always in the details. And Daniela, you know, in her research really brings that out. And for me, living on the continent, the personal is political. And these decisions make a difference between what hospital I can access, what hospital I can have children in, who pays for the school fees of the children that, you know, are going to school, and what quality of education are we looking for. And also, as a constitution, it sort of paints a picture of how we as a people want to be governed. Private finance seems to override that and override constitutional obligations of our state. And I think those questions are slowly being brought into the fray in terms of, this can't be right and this isn't working for us. With countries like Spain renationalizing private hospitals, what does that narrative begin to tell? And so I hope it's not going to be a repeat of 2007 and the financial, you know, meltdown that we had. And I hope we're learning lessons. And, you know, sometimes I sort of get disillusion. We're saying the same thing over and over and over again, but I think we have to, because it is these ideas that will be hanging around when we're trying to rebuild. And this idea of building back better, I think we need to get rid of that as a construct of a narrative. And we're not building back better. We're tearing it all down and saying this hasn't been working, and we really need to build something completely new, something completely transformative and radical that has, you know, takes over what has existed for so many years and has obviously not worked at all. Thanks. I'll pass on to Ingrid.
Thank you so much. That was really excellent and very so nice to hear both of your perspectives, so coordinated. To the audience, you can put questions in the Q&A box now. I'll ask a question that I have and take one from the Q&A box, and then I'll pass it back to the speakers. We have about 15 minutes of Q&A. So I'm interested in, because I think you explained very well the problems with the current system and private finance and how it's not really working to the benefit of the people in developing countries and women in particular. So what kind of alternative do you envision? What would be like a reform, radical or not, that you think is possible? And what are the obstacles to this kind of reform? Because especially as Crystal said at the end, this is a kind of old question that we keep going on and on about. So is it because, like, do people, like, does the World Bank, do the rich investors, do they not know about sort of the negative impacts of these policies? Who's pushing for better policies, and where are the obstacles? Like, what needs to change, and who's trying to change it, and why isn't it possible for them to do it? So that's kind of a political economy question about how to get to something different that's better. How we need to tear things down to build something different. And then I'm going to take a question from Helen Brown in the Q&A box. So she asks, is there any hope for countries ever being able to pay off the PPP contracts? Are there cases where countries have to use national budgets to continue to service debts whereby the underlying asset has long since been degraded? So either of you can start with whichever question you prefer.
Okay, I'll give it a go. So I think, like Daniela said, a lot of the narrative as to why we're drawn into this maximizing for finance for development and PPPs is a lack of resources. And, in 2015, when there was the financing for development meeting, developing countries were given two options. Development aid is dwindling, so either private finance or domestic resource mobilization, which is really essentially taxation. 70% of our countries usually will be in the informal sector, and that leaves us very little in terms of how do you mobilize domestically resources to make sure that you're developing. And for us, there's the Thabo Mbeki report that came out in 2015. Illicit financial flows are a huge, huge problem, and something that can be very low-hanging fruit to begin to change with, but the political dimensions and impacts of that are massive. And so really what has been pushed for, and Africa loses a minimum of $100 billion every year through illicit financial flows. The narrative around corruption doesn't hold water very well, because it's only 5% of that amount that leads through corrupt activity. 65% of the $100 billion leads through commercial activity. And so that's where we need to be focusing our energies in terms of what we need to do. There's a push to make sure that there's a tax or global tax body, preferably at the United Nations, democratizing decision-making around tax, legislation and frameworks as well, and policies around that. Right now, the OECD leads that work. African countries are not privy to those discussion tables, yet we are supposed to implement on equal footing, whatever that means. And of course, the frameworks and policies are geared against us. And so very broad stroke calculations, I think the global South, Africa, Latin America, and Asia contribute over 65% of raw materials and labor to the global economy, but only accrue less than almost 5% of wealth coming out of that. And so you can see where wealth lies. We're very, there's a very extractive process where labor and raw materials come out, but where the value is doesn't seem to be there. And so there's a question of a redistribution, and tax has a redistributive role globally, but also there's a question of generating wealth and resources. And I think we also need to look into, like, what does that mean outside of taxation policy? What does it mean to have equitable wealth generation, and who's creating this wealth generation? There's this whole narrative around entrepreneurship as a silver bullet to all our problems, but we have to remember who financed the Facebook and Microsoft and all these things, and it's state resources around academic research, around R&D, and that cannot be forgotten. And the skew with that in terms of a global divide needs to be addressed and needs to be analyzed as well. Somebody also asked a question around how what the gender impacts of PPPs. When any social spending that is relevant to women is usually the first off budget. It's the first budget cut that will happen. And so when we're paying back these increasingly crazy debts that we're servicing these PPP contracts with, but also in terms of what projects get implemented, anything to do with touching women's lives is definitely not on the table because it's not profitable yet. Our tax is going to be used to pay back for these services. So I'll give you an example. In Kenya, we've built an SGR train, which is supposedly efficient, which is the line that is used for private finance, is that it's more efficient. This train goes at a maximum speed of about 120 kilometers per hour. I'm not so sure how efficient that is, but it's about 7% of our GDP that we're in debt for this train. Now, the resourcing to make sure that we're paying for this debt is coming out of taxpayers' money, a majority of which, because through illicit financial flows, the tax burden is on consumable tax and VAT. A large percentage of women's income is spent on consumables, and they're the ones who are carrying the burden of the consumable tax. And so that gives you an example of how that manifests in a gendered way. They could have used the money to build inroads into more rural places. 60% of Africa's food is grown by smallholder farmers who have no access to bigger markets. There's questions around who makes those decisions. They could have spent the money in maternal health care. 68% of women in northeastern Kenya can't access a health facility to have a baby, and so their maternal mortality rates are super high. And so questions around then, could that have been a better use of money? So definitely the gendered impacts permeate like all ways of life. But I won't finish my time, and I'll let Daniela speak to the questions as well.
Thank you. I would just say on Ingrid's question, I think it's a very critical question, because particularly for academics, because we're very good at criticizing, but not always so good at producing, I guess, politically possible alternatives. And here I'm going to be a bit, to show my age. I'm now middle-aged and maybe less able to dream like Che Guevara of impossible things, but more like of things that have been tried in the past, but maybe we can do them better. And usually when I think about the question of what is the alternative to a development discourse that somehow promises to deliver on developmental ambitions by putting private finance at its core, I can't help thinking that there has to be some way in which we can reclaim the institutional infrastructure around the state, that it works better for its citizens. Because at the moment, more and more of the state, even with this example I gave you of PPPs, but in general, of PPP offices, but in general, more and more of the infrastructure of the state and the technocratic capacity of the state is being directed towards managing the terms of the engagement with private finance in its PPP or other forms. So I think for me, the conversation always has to start, and this is where my mildly conservative roots come in, from reclaiming the state and creating a better state that it's able to deliver on its social contract with its citizens. And maybe we can learn from the experiences of the failures of the developmental state in the past, which we know in many ways had been much more authoritarian than feminists would like to recognize. But maybe it is possible to reinvent a state that does participation better and that does engagement with gendered issues and participatory sort of methods of underlying the social contract in a better way. I personally don't think that we can have a viable alternative if we don't put the reform of the state at the center of our efforts. And there are many ways to think about how do you reform the developmental state and how do you create a much more reliable developmental state. And we don't have time for them, but I would suggest that this is where the conversation should start in terms of thinking of the alternatives. And getting putting a stop to illicit financial flows is of course very important part of it, because in a sense it stops a very important sort of channel of sort of hemorrhaging public resources from the state. And then with the hemorrhaging of public resources, we know this is what the Washington Consensus did very well, right? It basically hit at the basis and eroded the institutional capacity of the state to design and deliver on projects that would have improved people's lives in a variety of ways. As for the gendered impact of PPPs and where we can find them, I think Crystal already touched on it. I would just say, I think about it in terms of what gets built, who pays for the stuff that gets built through PPPs, and what doesn't get funded because of what gets built, right? And I think in terms of what gets built, PPP projects are always going to be sort of indirectly and implicitly favoring mega infrastructure, because in order to create assets for the global institutional investors, they need to be big. You can't do small things. Otherwise, you have to package them all together, and it's a headache. So there is a preference for big infrastructure projects, and it's not very clear to me. I mean, Crystal has already told you, but it's not very clear to me that this directly and clearly benefit women. They clearly and directly don't benefit women if you put a user fees on energy, or you increase user fees on energy consumption, if you put user fees on health access, if you put user fees on education. These are areas where clearly there is a very, very direct gender aspect that I would say makes women's lives worse in this shift towards PPP-based social infrastructure. And what doesn't get funded already, Crystal told you the story. This is not just about, I mean, Kenya is an excellent example, and I cannot throw numbers at you in the same way that Crystal does, which I should be able to do, but you can see the same sort of logic almost everywhere. Simply, if you have to redirect fiscal resources from financing social spending, for example, towards making sure that you honor the commitments that are written in PPP contracts, then obviously there will be cuts will start to happen. And it's not only in social spending, but education always gets hit as well. And with it, the capacity to create the kind of workforce that would be able to meet sort of the ambitions of a better and new developmental state. I would say also, I'm looking at the questions here, whether Islamic finance plays a role. This is, I think, a very interesting question in the infrastructure as an asset class. Yeah, I haven't seen it typically being mentioned. David Rothwell, thank you for the question. I'll have a look. I guess the project is still very much in terms of mainstream finance that generates returns. Otherwise, you would have very few investors interested. But I don't know the real, the actual answer to that. And in terms of countries' abilities or hope to pay off PPP contracts, I mean, we are not suggesting here, I mean, this is not a conspiracy theory in the sense that you have to pay for PPPs forever. There are very clear legal conditions that specify what you need to pay and how. And the World Bank put out a very interesting paper at the beginning of the year where it looks at the kind of de-risking frameworks that countries could be adopting when they go for this PPP-based infrastructure as an asset class. And there a lot depends on the politics of negotiating PPPs within national contexts. And there are many interesting people. The Heinrich Böll Foundation in the US published recently a book looking at the legal aspects of PPPs and how they reinforce certain global north, global south inequalities. Because, you know, if your institutional investors or your PPP German or French firm comes with 20 white men in suits who are paid a lot more than, who pay a lot more on their shoes than I get in annual income as a lecturer, then obviously the level playing field is already skewed very, very severely, even at the beginning of the process in terms of the legal terms. So I would say countries will use more and more of their national budgets to meet those demands. If they don't, we of course have another monster child of neoliberalism and the Washington Consensus and free trade agreements, which is ISDS processes, in which countries can be taken by private companies to private arbitration courts, and there then you have to pay. If you don't pay, then New York will make sure that it seizes your assets. So there is a pretty significant sort of strategic project that has very many pillars that are being sort of tight knitly together in order to make sure that countries are caught up in new forms of financial dependency. And I would say the only alternative is, well, I don't know, dream better and dream the impossible.
Okay, great. That's a good note to end on, I guess, because now we've run out of time. But this is really interesting and a really great conversation about how finance and gender are linked together. And it's important to think of how finance has gendered impacts as well. So thank you. I'll hand the floor over to Jessica now.
Thank you very much, Ingrid, and thank you again to our panelists, Crystal and Daniela. And thank you a lot to everyone else for coming in and listening and for your questions. If you'd like to get in touch with us, or if you have any other follow-up questions, please do get in touch with the IGDC. There's our contacts on our website, but also be in touch with Ingrid, and she will also redirect your questions to the panelists. I'm sure we've all learned something today from these discussions. I'd like to remind you about our next webinar in the series. So we're taking a break over the next few weeks, and our next 2 webinars will come back in October and November, and they will be on health and on migration, which are really very, very kind of health linked to COVID. That's kind of vague, but also the issue of global migration in response to COVID. And so we will have this in October and November, and we'll post the details of the webinars on the IGDC events page very soon. Lastly, we have Ingrid, who is also leading online sessions at the annual conference of the Association for Heterodox Economics. If you're interested in economics and heterodox economics, please do check out the chat section, and you will see a link to the conference. And thank you very much for attending this session today, and we really look forward to seeing you again next time. Thank you.